stroke ready hospital ఎలా prepared గా ఉంటారు అనేది చూద్దాము. I invite Dr. Vandana Agarwal, who is the emergency physician. She is the first contact person for all the stroke cases in our hospital.
Good afternoon, everybody. I'm Dr. Vandana Agarwal. I take care of the emergency department at KIMS Sunshine. Stroke. Yeah, we have all heard a lot about it, and we all are discussing about time. Time is brain, definitely. We, as an emergency physician, we run against time to save the brain neurons. And why do we do that? And what is our main aim? Once the patient reaches the ED, emergency department, the patient who is in suspected acute stroke, patient needs to be evaluated thoroughly and then start the management. What does this evaluation deal with? The evaluation deals with the monitoring the initial vitals of the patient, which means temperature, the pulse, the blood pressure, and of course, point of care glucose, which plays a very important role in management of stroke patients. Imaging has to be done. All these things should be done within the first 60 minutes of the onset of the patient arrival at the ED. The first 10 to 15 minutes a doctor takes to evaluate the patient, which includes, as I said, monitoring the vitals and NIHS scoring. Within the first 25 minutes, we get the imaging modality, that is the CT scan of the brain has to be done. Within 45 minutes, that's the first 45 minutes, after discussing with the radiologist and the neurophysicians, the stroke team, we come to a diagnosis whether the stroke is an ischemic stroke or the hemorrhagic stroke. As it's already explained and told that hemorrhagic stroke means bleeding. Ischemic stroke is nothing but the clot, the thrombus. Once we come to a final diagnosis within the 45 minutes, then we go for thrombolysis if the patient is having an ischemic stroke. Hemorrhages do not need or cannot be done, thrombolysis cannot be done for hemorrhages. So the injection, the thrombolytic injection should be given in the first 60 minutes since the time of arrival of the patient to the ED. Hence, that is a very important and a most crucial time in the stroke patients. Why should we take the 60 minutes is very important. The delay we make in starting the treatment in the emergency, the patient may have a permanent brain damage. The earlier we start the treatment, we can prevent the permanent brain damage and the morbidity and mortality of the patient. Hence, these 60 minutes of evaluating the patient thoroughly and starting the treatment make a big difference in the stroke patients. Thank you so much.
Thank you, Dr. Vandana. మేము రియల్గా చూసామండి వాళ్ళు ఎంత డైనమిక్గా క్విక్గా చేస్తారు ఈ పని అనేది. ఎందుకంటే ఒక పేషెంట్ని స్ట్రెచ్చర్ మీద నుంచి అంబులెన్స్లో దింపాలి అంటేనే 3-4 మనుషుల సహాయం అవసరం అవుతుంది. వాళ్ళందరినీ కోఆర్డినేట్ చేయాలి. ఎక్కడ ఒక నిమిషం డిలే మన వైపు నుంచి ఉండకూడదు అనే తాపత్రయంతో అందరూ ప్రయత్నం చేస్తూ ఉంటారు. ఐ అప్రిషియేట్ యువర్ హార్డ్ వర్క్ అలాట్.
Like and subscribe Eagle Health and Beauty.